Did you know that nearly 1 in 6 Americans will experience a dental emergency in their lifetime? Crazy, right? Imagine being in so much pain that you have to rush to the ER. What would you do? So, let me tell you about the time I was literally rushed to the ER for emergency dental care. It was one of those moments when you realize just how crucial dental health really is. Trust me, you don't want to skip out on regular checkups. Alright, picture this. It was a regular Tuesday morning, and I was just enjoying my breakfast. I took a bite of toast, and suddenly, I felt this intense, shooting pain radiating through my jaw. At first, I thought it was just a little tooth sensitivity, but no, this was something much worse. I quickly realized that the pain was coming from the back of my mouth, right where my wisdom tooth was. Just my luck, right? So, as I tried to get through my day, the throbbing pain only got worse. I couldn't eat, I couldn't concentrate, and I definitely couldn't smile. I knew something had to be done, and fast. Let me tell you about the frantic journey to the ER. I was in so much pain that I couldn't even think straight. I called a friend to drive me because I was honestly freaking out. As we rushed through traffic, my mind was racing. What was causing this? Was I going to need surgery? The dreaded S word was haunting me. When we finally arrived at the ER, I was greeted by the chaos of the waiting room. People were coughing, kids were crying, and I was just sitting there holding my jaw like it was going to fall off any second. After what felt like an eternity, a nurse finally called me back to triage. They took my vitals and asked me a million questions about my dental history. I was just desperate for some relief. And then, the moment of truth arrived. I was taken into a small exam room, and the dentist walked in. He looked kind of serious, and I was just praying he had good news. After examining my mouth and taking some x-rays, he finally told me that my wisdom tooth was impacted and needed to come out, like, right then and there. I was so relieved to have a diagnosis. They managed to numb the area and got to work. I can't even describe the relief I felt once the pressure was gone. I walked out of that ER with a new appreciation for dental health, and a fresh prescription for painkillers. So, what did I learn from this whole crazy experience? First off, dental emergencies are no joke. If you start feeling any unusual pain, don't wait it out. Get it checked out ASAP. So, what can we do about it? Don't worry, here's the solution. Do you know? This mineral in your mouth to rebuild your gums and teeth. It may sound odd, but it is scientifically proven. According to a Harvard scientist, swallowing these newly discovered bacteria is all you need to do to fix all your dental issues, from gum bleeding and teeth rotting to bad breath and cavities. These amazingly efficient bacteria work by reconstructing your enamel, the outer layer of your teeth, making them 20x stronger than a normal tooth. Like a titanium shield against cavities, root infection and enamel erosion. Some say their teeth are now stronger than a dental implant. Who would have thought that a candy could save anyone struggling with tooth decay and inflamed gums? This natural, soft candy has stunned both scientists and people all around the world. Simply let it melt in your mouth, after brushing your teeth, to get rid of cavities almost overnight. It will not only restore your teeth, but also rebuild your gums and eliminate bad breath. See here the amazing results of 34,788 people who have already tried this. Check out the link in the description, and in only 10 seconds you will find out if your teeth have aged prematurely and whether you risk losing them in the next 2 years. Find the test in the description and what you can do to rejuvenate your teeth and gums. Click link in the description to do the test in the next 10 seconds.